Atrial flutter is a type of abnormal heart rhythm, or arrhythmia. It occurs when a short circuit in the heart causes the upper chambers, or the atria, to pump very rapidly. This is also known as atrial tachycardia. In atrial flutter, the atria typically beat between 240 and 360 beats per minute. There is usually a slower yet still regular ventricular response to this atrial tachycardia. The atrial tachycardia that is seen with A flutter is identified on an EKG by recurring, regular, sawtooth-shaped flutter waves. The flutter waves are seen with a conduction ratio of 3:1 or 4:1. This means there's either 3 sawtooth waves, then 1 QRS complex, or there's 4 sawtooth waves, then 1 QRS complex. Like I said before, the QRS complex is typically normal and has a regular rhythm, but sometimes there will be that slower ventricular response. To me, differentiating A flutter and AFib was hard at first, but knowing that A flutter produces this sawtooth pattern with the P waves on the EKG helps differentiate them. AFib has undetectable P waves and also has an irregular QRS complex. Normal electrical heart impulses are sent out from the sinus node in the right atrium. This node controls the heart rate and timing of heartbeats. The electrical impulses travel through the heart muscle in the atria, and this triggers the muscle to squeeze. In atrial flutter, an abnormal electrical circuit forms in the atria, and this often happens after some types of heart surgery, heart muscle damage, or other heart changes. This new circuit takes over the heart rhythm and causes the abnormal atrial fluttering. Atrial flutter can result in fast heart rates in a heart that doesn't work as well as it should. This causes symptoms and increases the risk for stroke. Signs and symptoms include shortness of breath, tiredness or fatigue, chest pain, fluttering heartbeats or palpitations, lightheadedness, and fainting. The goal in treatment of A flutter is to control the heart rate and to prevent strokes. To control the heart rate, patients may be given a prescription medication like diltiazem, beta blockers, or digoxin. To prevent stroke, the doctor may prescribe a blood thinner or an anticoagulant to prevent a blood clot in the heart. A blood clot in the heart could break free and travel to the brain, leading to a stroke. For A flutter, cardioversion may be used as well. Energy is sent as a shock that is synchronized with your heartbeat, and this restores normal rhythm. Sometimes patients may be started on an antiarrhythmic around the time of cardioversion because this can help maintain a normal rhythm for a longer period after the cardioversion. Cardiac ablation is sometimes used as well to treat A flutter. Through a catheter into the heart, either heat energy or cold energy is used to get rid of that abnormal electrical circuit that leads to A flutter. Although atrial flutter is not life-threatening at first, it does limit how well your heart pumps blood. This can cause a clot to form in your heart, and if the clot breaks loose, it could lead to a stroke. Over time, atrial flutter can weaken your heart muscle, and this can lead to heart failure. Atrial flutter is often linked to a similar heart rhythm called atrial fibrillation, and that can develop if A flutter goes untreated. If A flutter goes untreated, there can be life-threatening complications.